Hello, welcome to Franklin County Home Health Agency's Where the Heart Is. I'm Jennifer DeSablo, your host for today's show. Franklin County Home Health Agency is a nonprofit organization that has been providing home health care and hospice services to people of all ages throughout Franklin County since 1969. We are happy to bring you this monthly show dedicated to offering information about our agency's programs and services, as well as helpful tips to help you and your loved ones stay safe and healthy at home. On today's program, we'll be talking about the important work of assessing for and preventing falls, especially in our senior population. And to talk about that, I have two members from Franklin County Home Health Agency's adult rehab team. Marissa Hurley, a physical therapist who has been on the show before talking about physical therapy. Thank you for coming back.
Oh, no problem, Jen.
And Ariel Teitelbaum, and you are an occupational therapist at Franklin County Home Health. So again, thank you both for being here. And before we start talking about today's program, which is preventing falls in the senior population or understanding what falls mean for that population, let's just remind us a little bit about physical therapy at Franklin County Home Health, Marissa, and what brought you to that home care setting.
All right, well, home health PT, once you get out of the hospital, we help you stay out of the hospital. So a lot of debility and weakness, so if we can keep you strong enough to stay on your feet and stay home with your family through the holidays, we know we've done our job.
Awesome, thank you. And how about you, Ariel, with occupational therapy?
So a lot of what we focus on with occupational therapy are making modifications to people's home, finding the right equipment to help them keep doing what they really want to do. Like say they want to take a shower, but they're worried about falling or something while they're in the shower. We can help figure out what is the best equipment for them. We do a lot of training on energy conservation, and we do some stuff with cognition and vision too. So we're kind of a broad group. Yeah.
Great. And you two obviously work closely together as a team. Physical therapy, occupational therapy, and of course we have a speech therapist in our adult rehab program as well.
Yes.
So what brought you to the home care setting?
Well,
what attracts you?
What attracts us? Well, I don't know. It's nice to see them in their homes, and it's different than being in the hospital where you have a set structured day, and they must do this, they must do this. At home, they get to do what they want and what's important to them. So the goal setting is a lot more functional, which I really enjoy.
I agree. I think it's the functional nature of being at home and being able to help people be independent in what's important to them.
Yeah.
So we don't have to simulate stuff. We can go and do the actual thing. And I think the recommendations we make for PT and OT are very realistic in terms of what's really going to work.
Because you're right there in their own environment. You can talk about how their bed looks versus a hospital
Right, we're
bed
not
or another
pretending,
bed.
we're not simulating. We can actually try it and see.
Very
figure that
good.
out.
So both of you work with our adult rehab. So talk, before we talk about falls in particular, but what kind of patients do you see? What age range? What kind of conditions are they seeing?
We see a pretty general group of conditions, and most of our people that we see are probably over the age of 60, but not always. We do see some people who have cancer who are much younger.
Or, joint replacements that, their knees wore out a little early, active lifestyles.
Yeah.
So, but this time of year, we do get an influx of folks that do unfortunately have a slip and fall.
Right.
That's the biggest time of year when you get a hip fracture is this time of year because the ice is everywhere.
Right.
Yeah.
So that's sort of why we're here today, because
Exactly.
that's why.
Yeah, we're taping now. It's
Yeah.
winter. We're right in the
Right.
throes of icy conditions and snow and just bumpy areas. So yeah, it falls, and especially in this population that you see in the 60 and older, the senior population. What's so scary about falls? Why is it so important to understand what that means to this population?
Do you want me to? Well, a lot of times it's harder to recover when you're older. So that's a big thing. It's not like when you're a kid and you fall and you break your arm and then you wear a cast for like a month and then you're fine, that's it. With older adults, it's a lot. There's a lot of other complicating factors usually, and they just take longer to recover.
Some of those would include, low bone density, so the fracture could be much worse than if they were younger. If they have a sedentary lifestyle to begin with and they're not getting back up there and doing what they need to do to heal and to build the strength back. So there's a lot more to worry about when folks are older.
Okay, so you mentioned low bone density, perhaps osteoporosis or certain conditions. What are the other risk factors that contribute to this population being at risk for falls?
One is vision issues. So a lot of times people's vision gets worse as they get older, and sometimes they need to think about, putting in extra lighting or increasing contrast, because it's easier to trip if you can't see, or even making sure you have the right prescription glasses.
Oh, sure.
Because sometimes, you put off going to the eye doctor for years and your prescription may not be right.
Can you back up a second about contrast? What do you mean by that?
Well, sometimes for a lot of people, because we do see folks that have like macular degeneration or other type of vision issues, sometimes it's a really simple adaptation that can reduce the risk of falling. Like you can add bright tape to like the edge of a stair or something so that it's easier to see, so you don't just like walk right off the edge. Or some of us, like my house has this horrible drop down living room, and it would be probably a good idea to put some bright tape along that edge so people don't step off and not
Visual
realize.
reminder.
Yeah.
Good point.
Another one would be footwear. Footwear is really key, especially in the home. Some of our older adults don't get out as much, so they've got the same old pair of slippers that they've been wearing for the last 3 Christmases that might not fit them properly.
What do you recommend about slippers or not slippers?
Shuffling around, something that's going to fit your foot well, non-skid on the bottom, something rubber, and keep an eye on your feet, especially for our diabetics. They've got impaired sensation in their feet. They're bumping. They can't tell where they're at. So, a little bit of preventative stuff, thinking about what you're going to need to do.
I'm glad you mentioned the foot care. We always try to remind the community that we offer a foot clinic at Franklin County Home Health Agency and around the community, and that's a great place for folks to have a chance for someone to be looking at their feet while they're doing the nails and cutting the nails and things, but also gives a chance to check in on that, and of course their doctor. So you're talking more about you're beginning to talk a little bit about diseases and things that are intrinsic to person, their eyes or their bones, but you're also talking a little bit about the environment. So there's a lot of risk factors.
Environment's huge. Pets are a huge risk factor for falls. We see folks where their little dog or cat is at their side for the whole visit, every visit. They're not going anywhere, running up and down in between the legs of the walker. And the reaction time for some of our older adults isn't what it used to be. So it's tough to tell Fluffy to get out of the way.
They're great companions and they need them, but we need to watch where we're stepping. Sure. What are some other physical risk factors?
Well, one thing is medications. So sometimes people go to like their primary doctor, and then they have all these specialists, and sometimes everybody doesn't always know all the things you're being prescribed. So, and if you're taking too many medications that have like a sedative effect or affect your thinking, it can put you at a higher risk of falling. So one thing people can do is like make sure your primary has the full list, so that you can make sure you're not accidentally over medicating yourself.
Thank you.
Especially with drops in blood pressure. That's another big one that we see.
So talk about that. How does that affect your body?
If you are on too much blood pressure medication and it drops suddenly when you stand up, you might have a change in position very quickly. So a lot of education on some things that you could do to combat that. We always ask folks when they first stand up, if they're feeling dizzy, don't just head out. Give yourself a few seconds, take some deep breaths, make sure that you've got your feet underneath you before you start going. And some of that can be easily changed with this dosage changes with your doctor.
With medicine, or I imagine with watching what you're eating, if certain things might affect someone's sugar level at another time. Or Good. What about, you're talking a lot about going to the doctor. Let's talk about that team approach to this. Who all is involved? We have a physical therapist and occupational therapist here, but how do we work as a team to help this situation, preventing falls?
We have nurses as well, and they're really great for medication management. So they get all the medications that you're on, and they can go through, and if there's any discrepancies, they'll let the doctor know. But we all we really work as a team. So like Marissa might be working with someone on how to get stronger so that they don't fear falling as much, and their legs can support them better. Well, I might be working with them on, changing things in their environment so that they're safer doing all of these tasks. You know what I mean? So we work pretty closely together.
Sure.
So
would one program refer someone to
Yeah.
the next program? You don't start off with everything at once until you start seeing it.
In
Well,
some cases, the
sometimes you
doctor
do.
kind of knows going in that they're going to need all of us in some way, shape, or form. And then there's other occasions where I might just get called in and then through the course of my evaluation notice they might really need Ariel for this if it's outside my scope. There is some overlap in what we do. We're both very involved in home safety equipment, but there's definitely times where I definitely need Ariel's expertise for
Sure.
a few of the little nuance.
and vice versa.
Yeah,
Yeah.
very good. And of course, the patient is at the center of this team in that situation. Like you said, with home care, that's what's so great about home care. You have their own space and it's specific to them. So what a great gift for a patient to have so many people caring about you and looking out for you. And about how long might you, I guess every case is different, but how long do services last with patients depending on if somebody
totally
came out of the
depends.
hospital? It really
Yeah,
depends.
as long as there's a skilled need. Unfortunately, we can't stick around because you like us. That's usually the case. You know, you
You're
get
so
to
likable.
know someone, and we really enjoy spending time with them. But if we teach them the skills that they need to be safe and independent, and then we graduate them on, and then they could, usually the family takes over from there.
Yeah, and I'm glad you mentioned that. That is the goal of home care right
Yes.
there. Teaching and independence, and we're
Yeah.
able to do that.
And we often work with, sometimes the goal is the person themselves will be completely independent, and sometimes it's like that family group, like the person and their spouse.
Sure.
So we do a lot of family training.
Yeah, because as you're talking, I'm thinking of someone living alone, but like you said, there can be a spouse there, and you're going to need to have them looking out for
Yeah.
environmental factors and whatnot. Very good. So let's talk a little bit more about that environment. You did mention a few things, very good advice about using some bright tape or things that bring
Yeah.
attention. What else can happen in the home? Maybe
Oh,
walk
I
from
thought-
room to room and give us some environmental.
Well, one thing that's helpful is have a light by your bed so that when you have to get up and go to the bathroom in the middle of the night, you can turn the light on and not be like staggering around in the dark.
Another one would be throw rugs. They look nice, but if you use a device to walk, legs of walkers always get caught up on the edge of your carpet.
Yeah.
If you can take them up, please do. If not, use some double-sided tape, some sort of grip pad to keep it securely adhered to the ground.
That's a great idea.
And in the bathroom's kind of a spot where a lot of people have a lot of fear because, it can be slippery when you're wet, when you're getting in and out of the shower. So often we'll make recommendations about grab bars, like grab bar placement. And sometimes people want something to sit on in the shower so that they don't have to worry about falling. So there's a lot of different options for that, and we'll, assess how the person moves and what they really need and their situation in their bathroom and make recommendations for that.
Yeah. So simple things you can add to
Oh, yeah.
the bathroom. Grab bars that can be installed very easily, and
Yes.
we're talking about seats and bath mat, non-slip things I'm thinking of in the shower. Sure. Maybe a handheld
A
shower.
handheld shower is another really good option for people,
Yeah.
yeah.
Good.
And then they get to the outside of the house, and we make sure that you keep, salt or some sort of de-icer on your back steps. You don't want to get almost home for your doctor's appointment just to have to turn around and go back.
Yeah.
We also brought some yak tracks with
Oh,
us,
yeah.
didn't we?
Yeah.
So I use these because we're walking around in the ice, and these just fit right over your shoe. I don't know if I can show.
Sure. If you
Will
can
it-
get your foot up there.
So they're actually really easy to use, and they just fit right over your shoe. And then they're really wonderful in the ice. They really give you a good grip. Just take them off when you're in the house because they'll ruin your hardwood floors. And they're slippery on tile,
Oh yes.
which, yeah, so they're really great for the ice though.
Great.
So if you're out walking around, I recommend that people at least if they're not going to do this, then get good boots. So
Yeah.
you're not walking around in like your slippery, kind of springy sneakers.
Well, these
in
are
the
great.
ice.
I'm thinking, it is the giving season, and you've got some nice
Yeah.
ideas. And what a great little stocking stuffer
Yeah,
for
good
folks.
stocking
Yes, and you can get them at the hardware store, you can get them at the sporting goods store, you can find them pretty much anywhere up here in Vermont.
Yeah,
So.
one size fits all.
I think
Slip
so.
on there.
Well,
Yeah.
they're pretty
Smaller than
stretchy.
most,
Yeah.
Simple tips like that, but also, like you said, using salt, even just shoveling or keeping it clear.
Yeah.
Imagine. What about the kitchen? Let's going back to inside for a minute and going. You talked about the bathroom and the floors and lighting, but specific to the kitchen, are there concerns about falling?
Well, I think one thing that you want to think about in your whole house is clutter, because a lot of us, I myself included, are clutterers. And when say you're using a walker or a cane, when you have clutter all over the place, it makes it easier to trip. So in your kitchen, just try to make, or in your dining room, whatever, try to make your spaces more clear. A lot of people have throw rugs in their kitchen, so using the taping down strategy or getting rid of the throw rugs. But yeah, I think that would be
very good.
So
another thing you mentioned earlier, you said briefly, was about energy conservation. Tell us what that is, and how do you help people work on energy conservation?
Well, one of the comorbidities that a lot of our folks have is COPD. And our folks with COPD, well, one, they're afraid of not being able to breathe, so they limit what they're doing. When you're limiting what you're doing, you're getting weaker. When you're getting weaker, you're not able to keep your balance because you're not practicing those strategies. So what Ariel and I do as therapists is teach them ways to break down tasks. I remember there's times where you're telling me where someone's getting too tired trying to do an entire shower. So say, okay, well, let's just do the upper half and then take a break for a while. And, relaxation breathing, things to help keep them relaxed so they can build the confidence in order to be more independent.
That's a good point. I mean, wouldn't think about falling and, just breathing, having to be like a
anxiety is a huge factor.
Yeah, talk about that some more, the fear.
Well, the biggest risk factor we've been reading about in our research for this interview is the biggest predictor of a fall is a prior fall.
Right.
That fear really limits a lot of our folks because they said, well, I can't fall if I don't move. And then a whole host of things can happen after that. So if we can help them combat that fear and figuring out what's actually at the root of their problem, it's not usually an inability, it's just being afraid that they might not have gotten hurt the first time, but now they know that it could happen.
So it's like a snowball effect. They fell, it was a horrible experience, now they're afraid, and they're, like you said, they're not building strength because they aren't moving like they used to. So you come in and help them regain strength and that just confidence, I guess you're saying. That's a good point. So, they're preventable. This is a preventable thing, like you said, if you give people confidence and tools and tips, but they do happen. No matter what we do, accidents happen, falls happen. What happens then? What's the first thing, if a caregiver is nearby and someone falls, what do you tell them to do?
Well, we usually tell people to call 911 because you can get injured trying to lift your loved one off the floor. So generally we don't recommend doing that. So normally we say, if they do fall, then call 911.
Good point.
We do also have a lot of our folks at least get information on the Lifeline system or just the bracelet or the necklace. Sometimes if folks live alone, you don't even have to press the pendant. It's motion activated, so it can tell if you've fallen. So that's a really nice tool for, if your loved one is alone for a good portion of the day.
Yeah, that's great.
And we do training on how to get off the ground because sometimes maybe you fall but you didn't get hurt and you just kind of like slid off your chair or something. I mean, Marissa was just doing this with somebody the other day. How do you help somebody or how do you get off the ground? So that's a skill that the PTs often work with people on.
Yeah, that's good. You have fallen and you might not need to call somebody, or you might need to just get up to the chair to then talk with somebody about maybe being concerned about the fall or having been hurt. Yeah, good point. And so any other prevention measures we haven't mentioned that you'd want to bring up?
Well, if they haven't had a fall yet and we get in and there's some basic ways for us to assess how high of a risk they are. There are some just questionnaire tools where it's a self-assessment.
We have one of those which you can assess yourself.
Right. So
some questions.
The fall efficacy scale, and you can get it on the internet too.
The fall efficacy scale. Okay. Yep, so it's just asking you if you're concerned about getting dressed or undressed, how you're making meals, getting in and out of your chairs, so something easy to go through.
Yeah, and you rate yourself, and then it can give you a little feedback on where areas of concern are.
Yeah, to share.
And then during our actual assessments, there's a few quick tests that we can do. There's one called the timed up and go test, or the TUG if you want the therapy lingo, where we just ask the client to stand up with or without a device, depending on the person, walk 10 feet at a speed that feels comfortable for them, turn around, come back, and sit back down in the chair. Based on the amount of time that takes, that gives us an idea of their fall risk. For a healthy individual, it should take under 12 seconds. Once you become an older adult, the cutoff score gets a little bit higher. If you're a frail elderly adult in your home and you've got a walker and it's got the brakes and the swivel reels, we know that you're not going to be getting any speeding tickets with that. If you can make it under 32 seconds, we know that that's safe for you.
Yeah. And you've observed how they're doing that.
Right. If they could do it safely, they show good judgment, it gives us a good rough indicator of how high of a fall risk there are. If they do have other medical factors, vertigo, things like that, then we might have to go into some more testing of different things we could do to help them get a little bit more steady on their feet.
Okay, good. So assessing early on and reassessing and making sure that your plan of care is appropriate.
Yes.
Yeah, very good. What about other resources that people can go to for concerns about falls, or places where they might be able to buy things, or you mentioned online? Do you have any other resources to share?
Yeah, there's a ton of websites that are dedicated to like giving older adults or any adults information on falls. The one where I got that one from, which I'm not sure if I wrote down, but if you even just look online, there's a lot of information basically outlining what we've talked about today on things you can do in your home and how to stay active. Staying active is probably one of the best things you can do for yourself in terms of keeping your body strong, keeping your bones as strong as possible, so that you can retain your physical ability and reduce your risk of falling. So that's one thing everyone can do. It can be at many different levels. It doesn't have to be like running 3 miles or whatever. It could be like doing like chair aerobics even, or chair yoga, or Tai Chi, or there's a ton of different options that work on balance and coordination and strength that can help, I think, all older adults to whatever level kind of retain their physical ability to reduce their fall risk.
Absolutely. Staying active,
Yeah.
or I'm sure you do show exercises like she said you can do in the chair or somewhere. Yeah. Anything that you can show us here or talk about?
Well, it depends on the individual. Some folks, if their energy level doesn't allow them to do too much standing, there could be a lot of upper body stuff. A lot of it centers around your core strength and stability. So if you see them in their chair all day, but even just getting them to sit up straight and activate that core musculature, everything starts from the middle. So if that can stay strong, and then we can start doing some different functional reaching tasks outside their base of support, and then they build some confidence. Okay, maybe I can go this way or that way. Maybe I could try that standing up. So it's baby steps.
Yeah.
Especially if there has been a fall. It's getting up is the first step.
Good job. And like you said, just you're there. There's something everybody can do, and you can help them get to that point. So remind us how individuals can receive care from Franklin County Home Health if they need it.
Well, you have to be referred from a physician. So I think if you feel like you're getting weaker and you need assistance and help from us, you would call your doctor and ask for a referral.
Yep, your primary care physician.
Yes.
Some folks get referred straight from home, and other folks will come back from a rehab facility or the hospital, where typically those referrals come straight from the facility that they're at. But if you're home, nothing's happened yet, but you notice some changes, go see your primary care physician, and we can see what we can do to help you.
Excellent. So we want individuals to do that, talk to their doctor, loved ones who are concerned to encourage them to talk with the doctor or on a visit with them to bring these issues up so that it doesn't get an oversight. So we want to prevent these falls. Thank you, ladies, for all the work you do in Franklin County and for so many people. We really appreciate your work, and thanks for coming in today and talking about this topic. And if anybody watching has questions about preventing falls, as Ariel and Marissa mentioned, you can check things out online. We also have a website. You can learn more about our agency's programs and services at www.fchha.org, and you can call us at 802-527-7531. We thank you for watching today, and be well.